I'm Dr. Kelly Rouster-Stevens. Today I am here with Janiyah Sims and Christopher Reed. We are going to discuss their journey as they were diagnosed in childhood with lupus, as well as their transition from pediatric to adult care.
My name is Janiyah, and I was diagnosed with lupus in 2012. I was originally in Tifton, Georgia. That's where I'm originally from, and I went to my pediatrician several times due to weakness and fatigue, and he didn't understand or really know what was going on with me, so he referred me to Augusta, where they found out that my white blood cell count was extremely low. And here, this is when I was diagnosed with lupus.
Christopher, would you mind sharing your experience as you were diagnosed with lupus?
Yes, so I was in middle school when I began developing really bad headaches and stomach problems. And I had a pediatrician who followed me at that time, and she had no clue what was going on in my body. By the age of 16, I started developing arthritis, chest pains, shortness of breath, and finally my adult doctor, my adult PCP, decided to put me in the hospital after seeing a spot on my lungs. And immediately everything spiraled. From there, I had a seizure. I was put in ICU, and eventually I was tested for everything. And so eventually an infectious disease doctor determined that I had lupus. So that's how I was diagnosed.
Okay. And so like many people, both of you, it took some time before you were diagnosed, especially you, Chris. I bet that was really frustrating. It
was very frustrating. My parents removed me from public school because the system just did not understand my medical condition.
Yeah. Janiyah, what was school like for you after you were diagnosed with lupus?
Once I was diagnosed with lupus, the majority of the time I was away from school, but then when I started back, and this was after I was on prednisone for so long, so I was swollen at this time, you know, I was heavy, and I was in middle school at the time, so when I came back, everyone was like, what happened to her? So it was hard. Yeah, it was hard.
School's tough.
Yes. For
kids with lupus. I hear that all the time from my patients, and challenging too, but I think that's unique, is the school challenges can be tough. But I would like to point out that Janiyah, she is now in medical school, so congratulations.
Thank
big
you.
Achievement. And I think that shows that even though you're diagnosed as a child with lupus, you can grow up and do whatever you want to do and pursue whatever you want to pursue. Yeah. Chris went to law school. Yeah. So yeah, do you want to share that journey?
Yeah, so it took me a while to graduate from college. In fact, because of lupus, it took me 8 years to actually graduate from college, but immediately I managed, despite the fact that I had lupus flares while in college, I had 0 flares while I was in law school. So amazingly, a very stressful environment, but I ended up with no flares and experienced a very successful law school career.
Tell me about your treatment. Let's start with Chris. What was that like, the treatment for lupus?
So I was treated with steroids, so high-dose prednisone. Like Janiyah said, there are so many different side effects that come with being on prednisone, particularly high-dose prednisone, including gaining weight. I went through that same difficult period of really being uncomfortable in my body. Luckily, my school knew of my diagnosis. Eventually, I even told all the students about my diagnosis, and they understood, and I didn't get the teasing that Janiyah went through because everyone was understood that I was on this high-dose medicine and it was causing me to gain weight.
Yeah. Janiyah, would you mind sharing your treatment journey?
November 2015, a study nurse came and asked my mother if she would like to enroll me in a study. So they wanted to get the drug approved in pediatric patients because at the time it wasn't approved. They wanted me to be one of the participants. They would basically just monitor my symptoms. I started getting better based off my symptoms. My doctor already knew that I was receiving the medicine a couple months or either a year later. We were notified that I actually was receiving the drug. I was off of the drug for about 6 months due to insurance issues, and my insurance wouldn't approve the drug, even though I had been on it for so many years, but previously the study was covering. And so we eventually got it approved. So now I currently receive Benlysta infusion once a month.
Thank you for being a part of the research study, because you're helping a lot of other people now by doing that. The journey of being diagnosed with lupus as a child is not for the faint of heart, and you both have done an amazing job, and just want to thank you for sharing everything with us today, and I wish you nothing but the best. And you already are blowing my mind, so continue to do that.
Thank you.
Thank you.